Medplane.com. Medical talk made simple. Lymphedema, a common vascular problem seen in cancer patients, gets a large chunk in the total cost of cancer management. However, a new study published by PLoS One reveals that home-based lymphedema management using a pneumatic compression device, or PDC for short, which is an inflatable garment for the legs, arms, chest, or trunk, can actually cut the cost and improve treatment outcomes in patients suffering from cancer. The researchers found that using these pneumatic compression devices helped decrease the number of outpatient visits, hospitalizations, and physical therapy use. PDC also reduces the occurrence of cellulitis in cancer patients. Cellulitis is a potentially serious bacterial infection of the skin and underlying soft tissue. Lymphedema occurs when protein-rich fluids accumulate in these tissues. It usually happens in any kind of cancer or its treatment. Most breast cancer patients have upper extremity lymphedema, meaning in the arms, while patients suffering from uterine or ovarian cancer, prostate cancer, lymphoma, and melanoma have lower extremity lymphedema, meaning hips and legs. Lymphedema is commonly associated with cellulitis. Lymphedema can provoke local inflammation caused by infection or injury, resulting in the development of cellulitis. According to the National Cancer Institute, about 80% of cancer patients develop lymphedema within 3 years after surgery. However, despite its rampant occurrence in the medical world, lymphedema is one of the most poorly understood and least researched cancer complications. The healthcare cost associated with lymphedema is high. People with cancer usually spend around $62,000 per year for lymphedema treatment. Office visits, which is 36% of the entire cost spent per year, accounts for the largest cost shelled out by patients. However, PDCs cut the total cost of lymphedema treatment by 18%, roughly $11,000 per year. Pneumatic compression devices are inflatable garments that intermittently inflate and deflate. Its intermittent inflation and deflation has only one objective: to squeeze and displace the blood from the underlying deep veins. This ensures that there's always a continuous flow of blood within the veins, and fluids are prevented from seeping through the tissues surrounding the blood vessels. Medicare and Medicaid services cover the use of PDCs in the home setting, according to cms.gov. However, this is only true for patients who've tried a 4-week trial of conservative therapy, and the managing physician has noted no significant improvement after the trial. The conservative therapy must include the appropriate use of compression garment of bandage system, elevation of the affected limb, and exercises. Get the latest health news and info at medplane.com, and hope to see you on Facebook and Twitter.